Welcome back. You're watching Signature Television. Hope you're good out there. Very recently, we heard about this latest development in Rivers State where the Commissioner for Health, Dr. Adaeze Oreh, absolutely gave some fantastic interview giving how the ministry have in one way busted so many syndicated medical centers that were fake in that state. We would interview her right now to hear specifically what had happened in River State and how she is going on with these types of engagements. Good to have you. Good morning, madam. Thank you so much for joining us this morning. Thank you for your time.
All right, to start
Thank you.
off,
Good morning.
we want to know, what is medical quackery all about?
So, thank you very much for inviting me, and thank you for the question. I think the actions we're taking in River State are also an opportunity to build awareness about what medical quackery is. So we all know this, medicine is a specialized area of training, basically for health and well-being of the population. Now, there are rigorous aspects to the training and qualification that is required for someone to be termed a medical practitioner. And for that reason, there are very strict regulatory requirements for both the practitioner and the place of practice of medicine. So what we found within the River State health sector was that there was a proliferation of facilities that were offering medical services to the public without, one, having the requisite qualifications of the so-called medical personnel, two, without the facilities adhering to the required standards and guidelines for such facilities to offer medical services. And so in the River State Ministry of Health, we set up a committee, the Medical Anti-Quackery Committee. And this is not just us in the Ministry of Health. We're working with the Nigerian Medical Association, the River State branch. We're working with the security agencies as well, some distinguished and recognized reputable medical practitioners known within the state. What this committee aims to do is to receive reports from the public, and that's also why we're working hand in hand with the NMA, the Nigerian Medical Association, because this is the association that represents medical practitioners in general. And so any facility that we'll be going to, it would either be a member or someone posing as a member of the NMA offering services in such a facility. And so it's just been several months since we started this committee and this task force, and we have had to seal not less than 12 different facilities scattered around the state. Some of them, the proprietors and the practitioners did not have medical qualifications. We have examples of people who studied agriculture, people who studied engineering, opening these facilities and offering medical services to the public. Aside from that, there were some facilities where there were actually medical practitioners who had graduated from medical school, but the facilities did not adhere to the standards and the guidelines that are required for facilities to offer quality care that can safeguard and protect the lives of the public. And so the reasons for sealing several facilities are varied, and each one is addressed on a case-by-case basis. And we work with the security agencies so that where criminal charges need to be brought up, those criminal charges will be followed through with the perpetrators of such facilities. And something interesting that we also found, some of these facilities are also offering training to general public so that they can further perpetrate this and perpetuate it in different locales. So it's not just about them practicing illegally and unethically, but also trying to perpetuate this for more people to start offering such unethical and criminal services to the public. And so if we're talking about safeguarding the lives, the health and the well-being of the people of River State, definitely this is also something that we need to tackle, to sanitize the entire health sector. Thank you.
Okay, I'm just wondering, being curious right now. Of course, I know that this is within your rights and, of course, the office that you occupy. But I want to, understand. Is there any trend or is there anything that motivated this discovery? Is there any trend in terms of disease outbreak, in terms of death, in terms of threats to life that motivated the ministry to go into this discovery?
I think being perceptive of public opinion was one thing that we hold very dearly in the Ministry of Health is being open to reports from the public. So some of these came as reports, people saying went to a facility and just something seemed off about how they were attending to patients. There was one of the facilities, some of the comments from members of the public who went to such facilities is that they noticed that from getting into the facility, people were being attended to on the floor, on the bare cement floor. That was one. Another was from one of the public facilities, higher public facilities, receiving a referral note that was shoddily done and raised the suspicion of the medical personnel in that referral facility. And so they did a report to the task force saying that we should investigate what was going on because the nature of the referral letter was completely off and below what would be expected from a trained, qualified medical practitioner. For another, and in another case, it was someone who uploaded on social media, and the press got wind of it as well, that they had been unethically treated in one of the facilities. So like I said, it's different. It's not like we just suddenly got an inspiration from nowhere, but it's also being in touch with community voices and hearing the experiences of people and not discounting people's experiences. So following through on what we get from the public, we followed this and saw that it was actually a growing problem within the health space that needed to be addressed.
Would you say that this quackery is being motivated by poverty or unemployment? What exactly is fueling this prevalence of quackery and unethical practices in Rivers State?
Well, I would say, first of all, that based on what we're seeing, I know that it's not peculiar to Rivers State. It's just that this is something that we are tackling in Rivers State. And secondly, yes, there is an economic component to it, but there's always an economic component to crime. And so the fact that there are economic challenges shouldn't be a justification for someone to enter into a criminal enterprise. Remember that one of the mandates of the Ministry of Health is to ensure standards and quality of medical services. And if this also means finding illegal facilities that are facilities that are carrying out medical practice unethically and therefore jeopardizing the lives of both citizens and residents of the state, then this is something that also comes under the mandate. But I don't think that poverty and the challenging economy is a justification for people to open facilities that put the lives and the well-being of the public at risk. And that's why there are regulatory agencies, and we in the Ministry of Health take this problem as something that needs to be tackled head on.
All right, I just want to find out, how aware do you think that residents of Rivers State know about these quackeries? Because nobody would know that the person that they are interfacing with is fake, and they go ahead to want to, patronize them. Are the residents of Rivers State aware, and how aware are they in terms of, engaging these quackeries?
I would say that the awareness has built with the work that we're doing, because some of these facilities are embedded within communities. And I'll give an example. I won't state the particular community, but there were in past 2 months, there were some facilities that we shut down, and we had community leaders come to the ministry to interface on behalf of those facilities. Now, just like you said, some of the community members may not even know that such facilities are quacks because they don't have the requisite information about the qualifications or the standards that are required. And this is where we, as the, will I say, the gatekeepers of safety within the healthcare space have to come in. And that's why with every action that is taken against any of these facilities, we work closely with the press to disseminate the information, inform the public, state why those facilities were shut, hoping that in that process we're generating increased awareness, we're sensitizing the public about the presence of such unethical or illegal facilities within the community so that people can start asking questions. Everything we do, we publicize and we speak to the public and educate the public about it.
How adequate are the health facilities in Rivers State? Would you say that it's enough to go around Rivers State, so that if you have adequate facilities that is health based, I mean, you would have to strangle off these ones that are quacks. So are the health services in Rivers State adequate, and to what extent?
So I would say that the health facilities in Rivers, they're work in progress. When we came on board in this role in June last year, there was a system with 340 primary healthcare centers, 20 general hospitals and zonal hospitals, and then the state teaching hospital, and of course the Federal University of Port Harcourt teaching hospital. This is in the public space now, and aside from registered and qualified private practices. So we knew that there was a gap. A lot of the general hospitals and zonal hospitals across the state were not sufficient to provide adequate referral services. And so you would find people leave the primary healthcare sector, maybe several general hospitals were adequate for referral, but they would then leap to the tertiary institutions, which is a teaching hospital, thereby overburdening the teaching hospital facilities. So this, we found, was something that we call the missing middle, where we didn't have a very, very strong referral system. And several months ago, the Rivers State Executive Council, led by the Governor Siminalayi Fubara, approved the renovation and completion of zonal hospitals across the senatorial districts, so that these hospitals will then add substantial strength to the referral system in the state, so that people in communities outside of Port Harcourt would not need to leave their communities for more advanced treatment, because we also know that in trying to leave their communities to get to Port Harcourt because of quality of care, there's the transportation aspect, there's the time away from home, and it was just an unnecessary economic burden that we felt the need to alleviate and ensure that there are standard and quality facilities at the community level. And that work is ongoing. And very soon, several of those hospitals will be commissioned and opened immediately for the public to use. But we have a total of over 1,200, nearly 1,300 registered and qualified facilities. And this is across both the public and the private sector. So the fact that we all know that the health system within the country is challenged and fragile does not necessarily justify the proliferation of illegal entities supposedly to provide healthcare. Now, take note of the fact that many of those facilities are being run by people who do not have the necessary qualifications. Now, if you're interested in providing medical care that will save lives, improve health and well-being, then go through the process of getting the requisite training. Or if you're already trained, go through the process of being duly licensed and registered and recognized by the state. Anything outside of that is trying to cheat the system and exploit innocent innocent members of the public who would not know the difference between such an entity and one that is licensed and registered. It is about exploitation, and that is what we're trying to remove from the system.
Okay, I just wanted to ask, what is the relationship between traditional medicine and quackery? Because we've had reports where the ministry has shut down some medical facilities and of course hospitals, but we've not heard anything that has to do with traditional medicine.
You've not heard anything to do about traditional medicine, because traditional medicine is different from orthodox medicine. And within the Ministry of Health, within the Federal Ministry of Health, there's actually a department of traditional complementary and alternative medicine that looks into the regulation of such facilities. Of course, in health sector dialogue, the dialogue is open to everyone so that you know what people are doing and can contribute to ensuring that the public is protected. So when we are talking about sealing facilities, we're talking about orthodox medicine here, and this adherence to standards and guidelines as put down by the Medical and Dental Council of Nigeria and other regulatory bodies for the delivery of orthodox medicine and medical services to the public.
So it means there's nothing like quackery in terms of traditional medicine, because you talked about traditional medicine being an arm to the
Yes,
ministry. So I'm wondering, there must be something the ministry is doing, to also regulate these traditional medicine.
I think you may have missed what I said in health sector dialogue. The dialogue is open to everyone. And so in such dialogue, you know what even the traditional practitioners are doing. But where it relates to the facilities that we have just sealed, those were orthodox medicine facilities, supposedly orthodox medicine delivery facilities, and not traditional. That's why I want to just state the difference. It does not mean that we're not engaging with people across the health sector space. And that's why I also mentioned traditional, complementary, and alternative medicine as a department within the Federal Ministry of Health that coordinates, identifies those who are practicing traditional medicine.
All right. I mean, this is a very commendable move, but there could be more, given that there are several of them that was mentioned in that particular statement that you put out. But I'm just thinking, like, what sort of collaboration is the ministry having with heads of communities? Because some of these facilities are located right inside River State. I mean, hidden away from town, So one would wonder whether there's some sort of collaboration that the ministry is having with these heads of communities so as to identify these things. Because these facilities are built in localities, and sometimes they even pay homage to the heads of those communities. They come in like people who want to give services to the people, and then they stay there, and then they overstay their welcome, and then they become members of the community. So is there some sort of collaborations that the ministry is having with heads of communities around town? And of course, in educating the people as well, some sort of information flow between the ministry and these people in these communities?
You raised a fantastic point there, because if you noted in one of my earlier responses, I gave an example of community members actually coming to advocate for some of these facilities that were shut down several months ago. And like you rightly identified, some of these facilities are now embedded within communities. They are recognized within the communities, and community members just don't know that they're being exploited. So interestingly, last year, one of the things we did within the health sector in the state was the inauguration of the Southern religious and traditional ruler leaders' engagement. So this is a collaborative entity where we work closely with the traditional and religious leaders within communities, disseminate information, use it as a way of getting them informed about our activities and recognizing their role, their significant role as influencers within their communities. So that is how we engage. We recognize that there's no way we can be successful in not just the identification, but also protecting members of various communities without working hand in hand with the community leaders. So be they traditional or religious leaders within the communities.
All right, aside from this, what are the plans of the ministry going forward to safeguard, the people of the states? Are there other things that the ministry is doing in order to keep safe?
Yes, there's a whole lot of activities that we are undertaking to protect the lives of people within the states, ensure their health and well-being. But one that I would specifically like to share is our recent trainings of traditional birth attendants. And this is aimed at reducing maternal mortality and even newborn mortality within communities. In many communities, we know that women in the communities will go to traditional birth attendants, whether we like it or not, whether the facilities are there or not, and we recognize their role in healthcare delivery. And so we are working to bring them closer to the ministry so that we speak with them directly. We know what they do. We know the limits of their training, and we offer additional training to them so that they can easily recognize warning signs, they can recognize risk factors, and refer some of these women to facilities where they can get the care that they need. So this is something that we're doing at the community level to help ensure the safety of pregnant women, the safety of new mothers, and of course, their unborn children and the newborn.
Recently, we saw that Mpox was declared a global health emergency. And what is the ministry doing regarding that? And what measures have been taken to stop the spread, at least within the environment of Rivers State?
Yes, when it was first declared public health emergency within the country, in the earlier reports from Nigeria Center for Disease Control, Rivers State had a couple of cases that had been confirmed. And we swung into action with our Emergency Operations Center. We had our surveillance teams, our rapid response teams working across the different communities. We then sensitized our health workers across the communities to recognize the signs, have a high index of suspicion, also carried out community sensitization using various media, the traditional community means of disseminating information using traditional media, radio, and town criers in several communities, just to heighten the awareness and get people to report to facilities when they had suspicions. So our Emergency Operations Center has been active for all this time with a mindset of ensuring that suspicious cases get to be tested quickly, and if confirmed, the adequate protocol of treatment undertaken so that we limit the spread of the infection. And of course, I'm happy to share that since then, we haven't reported a growing number of cases of Mpox within the state. But our teams, rapid response teams, our surveillance teams have been on hand to, with a high index of suspicion across all our facilities so that we don't leave any stone unturned.
Beautiful work you're doing, madam. Just to wrap things up, I just wanted to find out, when someone discovers a medical center that is fake, how do they reach out to the ministry? What numbers should they be calling? Where should they go to if they need to be somewhere, for the ministry? And then what are the procedures to register a medical center? Because again, some people will say that the reason why they haven't registered their medical center is because, the processes can be cumbersome. I mean, it's government. So we have all of these bureaucracies that are littered here and there. And maybe because of that, they just go on with opening one, and then, they have people who patronize them, and then they just continue, even though according to the law, they might be, wrong. Even in your discovery, you found out some of them who have certificates that are quite qualified, but it's just that they did not register the center. So can you just put this in perspective?
Yes, we have a Directorate of Medical Services within the Ministry of Health. And when a facility seeks to open its doors, or a proprietor wants to open a facility, they should visit the Directorate of Medical Services and get it, because it's basically about submission of registration, qualification details, and an inspection that will take place from the team at the Ministry of Health to assess the facility and make sure that it adheres to certain guidelines. There are many facilities. In the process of registering, the ministry will make certain recommendations, say for placement of where they plan to have a surgical theater, or where they plan to have a newborn ward. Such suggestions have been taken on board, and they just improve the flow and improve the standard and quality of care that is delivered. So I know that people are very wary of bureaucratic processes and lengthy processes, but there's the saying, a stitch in time saves nine. So you just go through that one step of seeking every requisite recommendation and guideline that is required for your facility, and then you go to sleep and know that you're not worried about anything to do with the licensing. When you speak to your patients, when you open your doors to your patients, you know that anybody walking through your doors recognizes that you're a duly licensed and registered facility. So I think it's the ostrich phenomenon. Burying your head isn't going to save you at the end of the day. You might find yourself having to face criminal charges, which you would agree with me is not something pleasant that anyone wants to go through. So just report to the Directorate of Medical Services and get the necessary information on what you need to do. For the calls, the Ministry of Health has several emergency lines that have been publicized. We have 24-hour call service. So any of the calls that is related to a facility that a member of the public seeks to report, they can reach us on our medical emergency lines, 0904 0222281 or 0904 0222283 or 0904 0222285. Any of those numbers, someone will connect you, pass the message on to the task force for onward investigation of any of those facilities. So these lines that shared are the lines for our recently revitalized medical emergency services in Rivers State.
All right, so what are your final words to the people of Rivers at a time like this?
My final words to the people of Rivers, while thanking you, the fantastic team at Signature TV, is our mantra in Rivers State is health for all rivers. And we cannot adequately say that we're addressing health for all rivers if we're not carrying out our role to strengthen existing facilities that are registered, licensed, and qualified to deliver care, and removing criminal facilities from the healthcare space. That is our role, that is our responsibility, to sanitize the system so that members of the public can walk into facilities knowing that they will receive adequate care because they are in facilities that have been duly licensed and registered by the Rivers State Ministry of Health.
All right, thank you very much, Dr. Adaeze Chidinma Oreh, Commissioner of Health, Rivers State. Thank you for your insights this morning.
Your work is admired, and you are admired too.
Thank you very much for having me this morning. I mean, it's been fun talking to you. Thank you so much for helping us spread the message.
You're welcome. You're welcome. Thank you.